Hi, Dr. Mark Agresti, and today I'm going to discuss the 4 worst drugs made. I'm going to start with number 4, Tylenol. What's the problem with Tylenol? Acetaminophen. Remember Tylenol PM, Tylenol, cough. All these drugs contain acetaminophen. What's the problem with that? Acetaminophen in fairly standard doses, let's say, 500 milligrams could be a normal dose. 10-fold of that, say 20 pills, is a lethal overdose. It causes a dangerous reaction in your liver and shuts the liver down. Without your liver, you die. Now, what could make that worse? I'll tell you what could make that worse. Drinking alcohol. If you drink alcohol with the Tylenol, the lethal dose may be even lower, and the effects on the liver are even more deadly. So Tylenol is one of the most common drugs out there and is one of the most dangerous drugs. And it is a drug in which people have overdosed successfully in my office and died. That is not a good drug, and be very careful. It's hidden in a lot of over-the-counter cold medicines. It is not a drug to be played with. I wouldn't leave it around your house. If children take too much, 10, 20 pills, you're almost, say at 20 pills, realistically, at 500 milligrams, you're at a lethal overdose. 10 grams, 10,000 milligrams. So when I'm discussing the 4 worst drugs, number 3 would be methadone. Methadone's a problem because it's very easy to overdose. A standard dose, 40, 50, 60 milligrams for someone who takes it every day, or someone who takes it for pain management, or takes it to block the craving for heroin or Oxycontin or other opiates, is a normal dose, and people develop tolerance to it, so that doesn't affect the user who takes it every day. But if some innocent person is experimenting with it or takes it by accident, a normal dose that someone could take every day is easily a lethal overdose. What it does, it suppresses the respiratory system. You can't breathe, and if you can't breathe, you die. Pretty much 3 minutes, you're dead. And the drug lasts so long that you can't forcibly breathe for 24 hours. You'll eventually nod off for a couple minutes and die of suffocation. That's why methadone is number 3 on my list of the 4 most deadly drugs. Number 2, Alprazolam Xanax. Xanax is another drug. By itself, Xanax may be fairly well tolerated. You could take a lot of Xanax, Alprazolam, which is a benzodiazepine, and live. The problem is, you mix this with alcohol, you have a problem. You easily overdose because the effects of alcohol and Xanax are synergistic. You overdose, stop breathing, or get an aspiration pneumonia where you cough up contents from your stomach. Instead of swallowing it down, you cough it up into your lungs and drown in your own vomit. Not pleasant. Here's the other problem with the Xanax. I don't like this drug. You develop a tolerance to it, and you need more and more of the drug. So the dose keeps going up and up because you have interdose anxiety. And I think it's the one that's most used on the street because I think it is associated with a euphoric high. The problem with Xanax, once you get on a fairly, even a normal dose, and you stop it suddenly, you could have grand mal seizures and die. So if you've ever used Xanax for even a week, 2 weeks, you may develop a dependency, and if you stopped it suddenly, will develop a seizure. Now, the number 1 drug, I think, here in South Florida, for considered the most dangerous in my practice, would be Oxycontin. Oxycontin is so common. It seems it's easily accessible out there. People are not afraid of it, but it's a very powerful drug. And an 80 milligram, 1 pill, you could overdose, stop breathing, and die. Well, those are the 4 drugs which I find the most dangerous. Hopefully that helps people out there. And I would make sure you don't keep any of these drugs in your house. And I would recommend not taking any of them. Thank you, Dr. Mark Agresti.